So, sir, can you please share us a bit about your early life? What made you lead towards a career in medicine?
I graduated from the Armed Forces Medical College, that is AFMC, Pune, in 1981.
Sir, coming to preventive health, sir, I just want to know, sir, at what point in your journey did you start developing this deep conviction for preventive health?
It is that health cannot be sold. There's no market for health. All the hospital industry is centered around disease and sickness.
How did you finance the initial phase, like especially when the minimum requirement is of 100 crores? So how did you finance that part, and how did it go about from ideation to official launch?
My pitch was that they allow doctors to offer preventive healthcare services and link it with health insurance.
If you're a doctor, a healthcare student, or anyone who is thinking of building something in healthcare domain, this episode is for you. I welcome you all to another episode of MedHustlers, where we are decoding healthcare for you. I am Dr. Abhishek. I am co-founder and CEO of Parabox, and I have completed my MD in respiratory medicine from AIMS Rishikesh. Today's episode is not just about a career in medicine, it's about a mission. It's about a company called Hexa Preventia, a pioneering healthcare startup that is dealing with blending preventive health and health insurance. What do you call a doctor who served in the army, treated patients across borders, fought red tape, and yet found time to develop a healthcare business that could change the way India fights disease? You call him Dr. Trouble. Trust me, you don't want to miss his story. Stay with us till the very end because we are going to cover the lessons learned in the army and how they shape the clinical wisdom, journey from public to private to international healthcare, and the story behind the nickname Dr. Trouble, and how this idea of preventive healthcare was first initiated and how it is going to transform millions of lives. Let's dive into the incredible journey of purpose, persistence, and preventive healthcare featuring Lieutenant Colonel Dr. Kulwant sir. Good evening and welcome to our podcast, sir. It's a privilege to have you today.
Thank you, Dr. Abhishek, for giving me time to connect with your audience and share my thoughts.
So, sir, talking about your early life and education, so, sir, can you please share us a bit about your early life? What made you lead towards a career in medicine?
I graduated from the Armed Forces Medical College, that is AFMC, Pune, in 1981. From N batch, we call them alphabetically. So it is, I belong to N batch.
Okay.
So then I did my internship in Military Hospital, Jalandhar, and thereafter I joined the army as a lieutenant, as we normally do. And then on, served in the army in various capacities for next about 17 years. On the way, I got a chance to do my MD from a regional medical college, the Punjabi University, Patiala. And then I took premature retirement from the army in April 97. So, because I felt that I had better career prospects outside. So, after coming out of the army with the rank of lieutenant colonel, I served in the corporate sector in various corporate hospitals in Delhi for the next about 12 years as an internal medicine specialist. Then I went to Saudi Arabia to work in the Ministry of Health. All along, even during my MD days and subsequently in my practice as a internist, I was mostly working in the field of cardiology because this has been an area of special interest for me. So I was working as a non-invasive cardiologist or medical cardiologist. So in Saudi Arabia, they I was working in the Department of Cardiology, and they opened the hospital I was working in was a hospital at a place called Bisha. Now that is a teaching hospital, and there they were running a program jointly with the Johns Hopkins School of Medicine, USA, in cardiology. So it was for the local Saudi Arabian students. But the seats which were going vacant, the expats were allowed to compete for them. So at that late stage, I sat for the competition and got selected. And I did my PGP cardiology. They had a contact program and the online training and clinics and offline training. So I did my program, postgraduate program in cardiology. And then our hospital opened a cath lab and they wanted a interventional cardiologist. And they offered me that if you can do mm, fellowship in interventional cardiology, we will, under our privilege program, we will take you up in interventional cardiology. So I went to Hyderabad. There's a Trans Asia Academy of Interventional Cardiovascular Institute, TACWI. So I did a short course of fellowship over there and then worked in the field of interventional cardiology in Saudi Arabia for some years. Then I came back after spending 14 years there in about 1.5 years ago. And after coming back, rather than going for interventional cardiology, I decided to expand the scope of my practice into something which I have always loved. That was in the field of preventive healthcare. Actually, to tell you the truth, after doing graduation, Abhishek, I
Yes,
never wanted to do post graduation because I felt that there's so much in the field of preventive healthcare, which a medical graduate can do a wonderful job, and I wanted to do that. But everybody told me, uh, be practical. As a MBBS, you'll have very limited scope to work, so you have to do post graduation, and preferably you have to super specialize in these days. So, for practical reasons, I had to go for specialization and super specialization. But I realized uh, with quite a bit of distress that as I went into specialization and super specialization, my area of practice got restricted that much. So,
definitely.
as a interventional cardiologist, for example, I found that in interventional cardiology, jokingly, we interventionists amongst ourselves, we call ourselves plumbers. So all you are doing is that you are opening blocked pipes and putting stents there. So intellectually, I find it found that it was a very stimulating field. So now I am devoting my time and rest of my life to preventive healthcare. So now, so yeah, anything else? So that was a brief about what I've been uh, through in life till now.
Yes, sir.
Sir, coming to preventive health, sir, I just want to know, sir, at what point in your journey did you start developing this deep conviction for preventive healthcare?
Actually, all around, for I have been very keenly interested in preventive healthcare But I realized, like everybody else realizes, that health cannot be sold. There's no market for health. The all the hospital industry is centered around disease and sickness. So people come to us with a disease. Somebody has a bronchial asthma or acute attack of asthma, then he comes to you for your services as a pulmonologist. So, although we call ourselves healthcare, but there's very little we have to do with health. It's mostly we are centered, our work is centered around sickness. But unfortunately, in the sickness care, although there's nothing wrong with sickness care, to care for the sick and give them relief, and if possible, give them a cure, is a very noble thing to do, no doubt. But unfortunately, even in today's day and age, with all the advancements, scientific and technological advancements in the field of healthcare, still there's nothing much we can do. Most of the patients uh, in the realm of cardiology, for example, they would come to me after the 6 hours or the first initial 6 hours, which is called the golden period of 6 hours. Uh, they would come to me after that when most of the myocardium has already been lost forever. It cannot be recovered. So, uh, very few patients reach in the initial stages of a evolving AMI when a stent can be put and wonderful results can be achieved. And I think the same applies to all fields of specialization. My colleagues who are for example, oncologists, so they always lament that their patients come to us uh, at a stage when it is too late and when there's nothing much we can do. So, in curative services, even today, I have to admit, with a little heavy heart, that there's nothing much we can do. And whatever little we can do, it comes at a very heavy cost. No, the costs are very heavy. I've seen people coming to for with the AMI, and then for stent or for CABG, uh, having to sell their house and shift to a slum in a rented accommodation. That kind of heartbreaking things. I've seen it often in my practice. So, but uh, or the same uh, medical, same scientific and technological advancements in the field of preventive healthcare, in diagnostics and in therapeutics. Medical science has done wonders over the past few decades. But as there's no market for it, there's no commercial validation. These things do not see the light of the day. There's no there's no platform to launch these services from. I have been trying to uh, coax, motivate hospital owners over the past more than 2 decades to uh, invest their resources in preventive care. So sometimes they come out with most of the time they are reluctant to say the obvious in as many words. And sometimes a couple of them have been bold enough to frankly admit it to me. He says, Doctor, come on. Uh, uh, with this, you think that will be killing our all these services we have invested our time and resources in. Who will, if people stop falling sick, who will come to the hospital? But most of the people are not that candid about it. They are rather coy and they shy away from saying the obvious. Anyway, so I went to Apollo Hospital owner, Dr. Reddy, that was more than 20 years ago, and pleaded with him. And but they are too much invested in sick care to pay attention to preventive healthcare. So now I have launched a private limited company called Hexa Preventia. So through this, I am trying to link uh, preventive healthcare with health insurance.
You already explained what gap in the healthcare system inspired you to start this venture and what was the original idea behind it. I think our viewers got a gist of it. I would like to know a few steps, sir. What were the first initial steps that you took that took the company from ideation to official launch? And how did you finance the initial phase, like especially when the minimum requirement is of 100 crores? So how did you finance that part, and how did it go about from ideation to official launch?